Most of the actuaries responded that cost for the currently insurable individuals is going to go up significantly, 10%, maybe more, given the law stands as it is. But the rationale behind it is a few reasons. First of all, individual insurance right now may not be as generous, and the new law makes the plans, sets a minimum standard, so people are going to have to increase their benefits to be able to comply with the law. And increase benefits, increase cost. It's very simple. The individual mandate is a key component of the law. You have to get everybody in the pool to have the healthy risks and the less healthy risks to keep insurance affordable. However, the current individual mandate is rather weak, so there may not be a big difference between without it and with the current one, because people can make the financial self-selection that they know that paying the penalty is less than buying insurance, and insurance will be available. There's been a lot of publicity about the exchanges, and the exchanges starting in 2014. The actuaries, when surveyed, only 40% of them believe that that will do a better job at controlling costs than without the exchanges. People can shop for insurance. There are brokers out there. There's a few websites, and they may not be as sophisticated as the exchanges, but they exist if people want to shop for them. Another reason is that everybody thinks that when you have the one-stop shopping, sort of like Expedia, that people will compare, and the companies that are selling the products will be more competitive with each other. My experience has been right now that the insurers are competitive with each other, know what each other charge. So there is a competitive marketplace. So I don't know that just the exchange by itself is enough to change the course of the medical care rising costs. I think it's not going to make a big difference. I think it's not going to increase costs or decrease costs. We have about 50 million uninsured, round numbers, and the majority of the actuaries estimated somewhere between 10 and 30 million would gain coverage under the ACA. I do believe, as my colleagues do, that it will increase coverage. That's what the bill was meant to do, and there are many things in place that will do that. But we're still, none of us believe that it's going to cover the whole 50 million. And where is that gap? It's hard to outreach to some of these people. In fact, a big part of the expansion is the Medicaid expansion. And right now, a lot of those people are eligible. So they're already eligible, they just haven't enrolled, so they don't officially have insurance. And there's been many attempts to get these people to sign up for the program, and it's just very difficult. And you have to spend a lot of resources and outreach and get these people to sign up, because there's going to still have to be more work to be done until we get to a zero uninsurance rate.